Hi, this is Dr. Hadi. I'm going to be talking to you about your upcoming anterior hip replacement surgery. I'm going to be discussing hip replacement surgery, the post-operative care, and the possible post-operative complications that can occur. The hip joint is a ball and socket joint. You have the top of the femur that is covered with cartilage and the pelvic cup that's covered with cartilage as well. And with the arthritic process, the cartilage degenerates and wears down and leads to bone spurs and bone-and-bone arthritis, which is painful. This is an example of what an arthritic hip looks like on X-ray in comparison to a normal hip. You'll notice on the left side is an X-ray of a normal hip where you can see good spacing between the ball and the socket. And on the right side you can see a bone-on-bone arthritic hip where the cartilage is completely worn out. The anterior hip replacement surgery is done in a minimally invasive way. We go from the front where we can separate the muscles and not have to detach any muscles or tendons to do the surgery. Once we expose the hip, the replacement itself entails taking out all the arthritic bone from both the pelvis and the femur and replacing that with titanium implants. So that includes a titanium shell in the pelvis and a titanium pin in the femur bone with a ball and a lining to reproduce that hip replacement. In terms of the anesthetic, the anesthesiologist will talk to you about the different options. Usually we prefer doing a spinal for these kind of surgeries. And a spinal, in a sense, is injecting a medication in your back to numb you from the waist down. But you will be asleep through the surgery, you'll be sedated, you won't hear or know anything that's going on. And you will wake up in the recovery afterwards when everything is done without having the effects of the general anesthesia. The day prior to surgery, you're going to shower with Hibiclin soap as instructed. You do not want to shave your legs the day before or the day of surgery, and do not eat or drink after midnight, including water, chewing gum, or candy. On the morning of surgery, I will confirm which hip are we going to be operating on and mark that hip. The nurse will assist you out of bed the day of surgery and have you ready for your therapy session. And the physical therapist will work with you to get you ready to go home safely. Unfortunately, even the most minor of surgical operations carries some risk of complications occurring. Hip replacement surgery is very successful and complications are relatively uncommon, considering the complexity of the procedure. Most complications are temporary setbacks. You have about a 98% chance that you will go through the operation without some significant complication which causes an ongoing problem. The most common complication is blood clots in the legs. The most serious complication is infection. And the most important long-term complication is loosening or wear of your hip. As long as the clots remain in the legs, they are a relatively minor problem. Occasionally, they dislodge and travel through the heart to the lungs, causing what's called as a pulmonary embolism. Blood thinners will be given to you first day after surgery. Additionally, compressive calf pumps are used and leg exercises are encouraged to prevent blood clots. Unfortunately, blood clots can still occur despite all these precautions. When it comes to infection, the risk of deep infection in first-time hip replacement is approximately about 0.5 percentage point. Superficial wound redness and stitch abscesses are common in the first few weeks. They resolve quickly on antibiotics and are not included in these statistics. Antibiotics will be given to you before and after the operation to further help lower the rate of infection. You will be on oral antibiotics for 1 week after the surgery. You will have a waterproof dressing on your operative hip that you should keep on for 2 weeks till you are seen for your first post-operative visit. We will change the dressing on that visit. Patients who have had joint replacements must take antibiotics by mouth before any dental work for 2 years after their hip replacement, and must have all infections vigorously treated. Bleeding occurs during most surgical procedures. Bleeding is minimized during surgery with anesthesia and IV medications. Sometimes bleeding can occur into the wound in the days after the surgery, causing what's called a hematoma. Bruising is common and resolves in 4 to 6 weeks. Fractures can occur during implantation of the femoral component. This usually is a small crack, although major fractures can occur at times. Small cracks may need to be treated with what's called cerclage wires or cables, and may alter weight bearing for a few weeks after surgery. Post-operative fractures can occur as well if a fall occurs in the first few weeks after surgery. This may require fixation in the operating room. Dislocations can occur at times as well. A hip dislocation occurs when the head of the thigh bone or the femur slips out of its socket in the hip bone or the pelvis. In the first 6 weeks after the surgery, the ball is only held in the socket by the muscle tension. During this time, before scar tissue forms around the ball and before muscle strength returns, the hip is more prone and likely to dislocate. Having said that, the direct anterior hip replacement surgery is a safer approach that minimizes hip dislocation, as the muscles are spared, which helps keep the head of the femur in the socket. And as such, there is no need for hip precautions after the surgery. Loosening can occur as well, where loosening of the prosthesis from the bone is the most important long-term problem related to your hip replacement. How long the bond lasts between your prosthesis and the bone will depend on a number of factors: how well the surgery was done, the quality of your bones, how active you are, your weight, whether or not the implant is cemented, as uncemented implants do last longer, and the design of the implant and the materials used. With cementless fixation, fixation is via bony ingrowth between the implant and the surface of the bone. That creates a nice biologic fixation between the two. With the modern hip replacement surgery, multiple implant options and sizes are available to fit every anatomy and every person, from the shell to the femur component to the ball and to the lining of the socket. Wear of the plastic polyethylene socket starts from the day of the surgery and is more rapid in very active patients. But with the advent of highly cross-linked polyethylene, it promises a wear rate about half that of regular poly and improves our wear rate up to 8 to 10 times. And as such, we use cross-linked polyethylene routinely for all our hip replacements. The length of the leg may be changed by the surgery. Your arthritic hip is usually shorter than the other hip, and with hip replacement, we will restore the original length, so it may feel that your leg has become longer. Sometimes the leg will be deliberately lengthened in order to stabilize the hip or to improve muscle function. The first few weeks after surgery, most patients complain that the operated leg feels too long even when the legs are perfectly equal in length. This is an artificial sensation which will resolve itself after a few months. During the surgery, we do obtain x-rays to confirm proper implant placement and correction of leg length. This all starts prior to the surgery when we look at the x-rays and compare the operative side to the non-operative side and determine the leg length difference prior to surgery. And then during surgery we compare the operative side to the non-operative side and try to match it up as best as possible using x-rays. In virtually all cases, hip replacement will make a significant improvement in your pain and mobility. In most cases, you'll have no pain at all and the hip will feel normal. The completeness of the pain relief and the degree of mobility is partially determined by your hip problem prior to surgery. It is exceedingly rare to have an injury to the arteries or nerves of the leg, but possible. The major arteries of the leg lie close to the front of the hip joint. If the nerves to the leg are injured, they usually recover, but it may take up to 6 months or more for that to happen. Most patients have some numbness around their wounds. This decreases with time, but a small area may remain feeling numb permanently. Anesthetic complications can occur, and very rarely even death can occur from the anesthesia. Your anesthesiologist will see you prior to surgery and explain the risks involved. In conclusion, major surgery is not without risk. There are risks in everything we do in life. Our medical staff will do everything we can to minimize the risks that you undertake. The worse your preoperative symptoms are, the more reasonable it is that you take the risk inherent in having a hip replacement surgery. Remember that the main goal of your hip replacement is to improve your quality of life. We look forward to helping you through your upcoming hip replacement surgery. Hopefully this presentation has given you more insight about your upcoming surgery. Thank you.